And the message is still the same. Take responsibility to reduce the spread of infection for you and everyone around you. As global confirmed figures of the coronavirus reaches over 183 million cases. The Nigeria Center for Disease Control, NCDC, says the current level of control of COVID-19 outbreak in Nigeria can be partly attributed to the continuous application of strategies based on scientific evidence. It says the implementation of non-pharmaceutical interventions, NPIs, remain the key driver of success in the control of the virus globally. Now, 9 states reported 0 cases last night. Let's take a look at the update.
Nigerians must take precautions by pursuing proactive preventive measures to limit the spread of COVID-19. That's the message of the Nigeria Center for Disease Control, as they are encouraging all to take responsibility for protecting themselves against the virus. Daily infections appear to have declined as the NCDC announced 56 new cases reported from 3 states and the FCT in the last 24 hours. Lagos was the most impacted state with 47 new cases, followed by the FCT with 6. 2 cases were reported in Enugu, while 1 case was recorded in Gombe. According to the agency, there were 0 cases from 9 states, including Sokoto, Rivers, Imo, Nasarawa, Plateau, Kaduna, Oyo, Ekiti, and Kano. The total number of confirmed cases now stands at 167,859. 4 people have been discharged after testing negative to the virus, raising the total number of recoveries to 164,382. There were no casualties in the last 24 hours, leaving the fatality toll at 2,121. Presently, there are about 1,356 active cases in the country, while over 2.3 million samples have been tested so far. The latest update by the National Primary Healthcare Development Agency shows that more than 2.2 million eligible Nigerians have been vaccinated with the first dose of the vaccine, while over 1.1 million of those vaccinated with the first dose have now received their second. Lagos State is taking the lead as it has now vaccinated more than half of its eligible population, followed by FCT, Kano, Kaduna, and Oyo. In Africa, there are over 5.3 million confirmed cases of COVID-19 and more than 140,000 deaths on the continent. Across the world, there are more than 183 million confirmed cases, while deaths have surpassed over 3.9 million.
A delegation from the Lagos State government, led by the Commissioner for Health, Professor Akin Abayomi, and the Director General of the Lagos State Safety Commission, Mr. Lanre Mojola, have visited the Synagogue Church of All Nations at the weekend to inspect facilities at the church for COVID-19 safety and prevention protocols compliance in preparation for the funeral of its founder, late Prophet Temitope Joshua. Speaking after the inspection of the church facilities and meeting with church officials, Professor Abayomi said the inspection is in line with the third wave mitigation strategy of the Lagos State government to prevent the importation and spread of the new deadly strains of COVID-19 into Lagos and Nigeria.
The Prophet was a very significant personality with a large following. And in this very precarious times that we're in, with a global pandemic that is evolving dynamically. So what we now know is that there are different strains of the virus circulating around the world. And Lagos State has a very strong third wave prevention strategy. And the likely cause of a third wave is going to be an importation of visitors who are infected with the virus. And so we are particularly careful about working with the synagogue to make sure that we have a collaboration that will reduce the opportunity to zero of us either importing a virus or even allowing somebody who is positive to interact with communities.
Now, a coalition of civil society organizations in the nation's capital are calling on the National Assembly to urgently commence investigation into COVID-19 spending in the country by instituting a public hearing with invitation to all heads of agencies and committees that handle COVID-19 finances. Speaking at a joint news conference on COVID-19 transparency and accountability in Abuja, members of the group insist that COVID-19 related contracts and procurement processes were not transparently done to guarantee proper accountability. The group wants government to make public records of all spending so far made in the national response to the virus.
Nigeria is a signatory to the Open Government Partnership, which is supposed to be a game changer, in the fight against corruption. But when you don't provide access to information on procurement and contracting, then how would we even know what contract is being issued to the private sector and what services are meant to be delivered to the beneficiaries, which are people at the grassroots? 95% of corruption happens during procurement and contracting. Today, do we have access to public record on procurement and contracting? No, we don't. We want the National Assembly to host a public hearing and bring CBN, bring the Ministry of Finance, bring the Accountant General. Mind you, the Accountant General responded to our Freedom of Information letter, highlighting that they have 35 billion, they've disbursed at that time 30 billion, and they did not tell us what they would do with the 5 billion. So this is quite important for the National Assembly, particularly because their role is to provide oversight on the executive. And mind you, these expenditures, some of which have been budgeted for, released, and used. So I believe our representative at the National Assembly should heed to the call of civil society and call for a public hearing. So we don't wait until after 2 or 3 years and then they start releasing all the corrupt figures. Let's get these figures now and let's put people behind bars.
While staying with funding, a university don has asked the federal government not to be in a hurry to expend billions of naira earmarked for procurement of vaccines against COVID-19. The don, who acknowledged that the virus had taken its toll on global community, said Nigeria is expected to act based on its own needs and best interests, like countries with responsible governments. Joining us is Professor Emmanuel Obi-Okoro, is a professor of medicine, University of Ilorin, Kwara State. He joins us now on the program via Zoom. Thank you for joining us. All right, we'll come back to Professor Obi-Okoro very shortly. But as one of the strategies for making it easier to do business in Nigeria, the federal government has introduced MSME clinics to help businesses negatively affected by the coronavirus pandemic. According to the government, the clinics aim to bring together key frontier government agencies and stakeholders to interact together with a view of removing impending bottlenecks.
Although cases of the coronavirus pandemic have significantly reduced in Jigawa State, the effect it has had on small businesses is still being felt. Many businesses recorded huge losses, while some went under completely.
During COVID-19, or even after COVID-19, you see all our shops were closed, our businesses collapsed, no capital, no anything. I can tell you there are many shops that they were closed since then. Up to this moment, they will not be able to come back into their normal businesses.
To help businesses to bounce back after the devastating effect of the pandemic, the Vice President has launched MSME clinics in Jigawa State.
The MSME clinics were designed to bring the regulatory agencies whose work affects the business experience of MSMEs to meet with MSMEs in the same venue, because this is the opportunity that MSMEs have to bring their business problems to the attention of the regulatory agencies for solution.
The Jigawa State Governor Badr Abubakar believes the launch of the program is timely, considering the setbacks in the economy.
This program is about federal government support to business enterprises, which is critical to economic growth, job creation, employment generation, and poverty reduction. I believe this intervention is very timely, considering the setbacks suffered by MSMEs arising from the negative social and economic effect
The MSME clinics will serve as a one-stop shop for businesses, which is expected to simplify administrative procedures and guidelines for the issuance of business loans, permits and licenses. The hope is that small business owners see this as an opportunity to rebuild Nigeria's economy. From Dutse, the Jigawa State capital, Sadiq Ilyasu, Channels Television News.
Outside Nigeria, the South African Health Products Regulatory Authority has authorized the use of the Sinovac COVID-19 vaccine, with the country's slow vaccination rollout program having been criticized in different sectors. The authorization of the Sinovac jab is seen as a turning point and much-needed relief. Speaking with our South Africa correspondent, Brian Figeni, a professor of vaccinology, Shabir Madhi, says that the government's main aim should be inoculating the most vulnerable of the population. A little over 3 million people have been vaccinated so far, a far cry from the government's target of 40 million by the end of the year.
Yes, so the vaccine program obviously is extremely sluggish at the moment. The 3 million you refer to is roughly about 5% of the South African population. And right now, the Department of Health, at least in South Africa, hasn't met its own target, which is set to complete vaccination of people above the age of 60. Currently, it's only about 40% of people above the age of 60 that have been vaccinated. But the more important issue is that it's not necessary for South Africa to vaccinate 40 million people to be able to get back to a relatively normal lifestyle. The target is really vaccinating those 15 to 17 million people that are above the age of 60, as well as people with other medical conditions that are at high risk of ending up in hospital and dying of COVID-19. If we're able to get adequate penetration of the vaccine in those groups, about 80% coverage, we would still be able to get back to a relatively normal lifestyle, even with the virus continue circulating in our midst. Previously, the estimate of needing to vaccinate 40 million people was based on some aspirational goal of getting to herd immunity, which essentially means that you've brought about the complete disruption of the transmission of the virus. Unfortunately, that's no longer even an aspirational goal for countries such as South Africa. Because of the evolution of the virus, we can expect the virus to continue circulating probably for the rest of our lifetimes.
And we continue in Enugu State, where the government says it is expecting more vaccine from the federal government as it has exhausted the over 65,000 doses initially delivered to the state. According to the chairman of the state's governor's task force on COVID-19, Professor Ed Nwobodo, the government is still actively testing and taking people for treatment across testing, isolation and treatment centers. He also states that the government is taking steps ahead of the third wave if it eventually comes.
The Enugu State received about slightly over 65,000 doses. And as we speak, that has been exhausted. And it is expected that in the coming month or thereabout, we're expecting more doses from the government. There are rumors, whispers of a third wave, and indeed of variants that are perhaps more virulent, more transmissible. And so we can say that relative to the peak period of some months, many months back, there's definitely a dip. I mean, the numbers went down. And like I told you, we have active documentation process in which when a case tests positive, wherever, it's captured. And so we have up-to-date data with respect to. Apart from that, we have teams, a research team that periodically, and that's coordinated from that office, that little office there, that periodically just go into the populace. I mean, just move into a community and randomly test people.
We're still talking about the variants and the third wave and even the fourth wave outside Nigeria. 2 months after President Joe Biden pleaded with the nation to bring it home and stomp out the virus, the U.S. has officially fallen short of its goal to fully immunize 160 million Americans. It was a benchmark the new president set to try to rally the country eager to move on from lockdowns and other restrictions by promising a celebration of the nation's independence from the virus. Well, joining us for more on this is Dr. David Ajibade, CEO of Brain and Body Foundation. He's also a public health physician. Thanks for joining us. He joins us from Maryland in the U.S.
Thanks for having me.
All right. Now, I mean, it appears the U.S. has missed, they have missed the target. 70% of its population taking at least one dose by July 4th. How worried are you?
Well, thanks, Millicent. A little bit worried, a little not too worried. Remember that this was an aggressive target from the president. And yes, they've seen that they've not been able to make it, to meet it. So they've increased it now. They've changed the target now to 300 million in 150 days. But the good news is that the hospitalizations and deaths have dropped by over 90%, which is somehow good. And also the fact that most vulnerable people, the elderly, the sickly, have gotten their vaccinations. However, as you said, with the Independence Day and the celebrations, there's a risk that could change. But at the point, it's not as bad as it may sound.
So let's talk about the COVID-19 hotspots. We understand, that are emerging across the United States, fueled by the highly transmissible Delta variant, and also, on the other hand, the lagging vaccination rates, California, Nevada, Missouri. Do you expect that there will be perhaps even more spikes, especially with the summer?
Oh yeah. It's highly likely. The hope is that, especially with the Independence Day celebrations, today is actually a holiday. Yesterday was Independence Day, and they've been celebrating throughout the weekend and up until today. So there's going to be a lot of travel. There's going to be a lot of outdoors activities, a lot of indoor activities. The younger folks, the 18 to 29-year-olds, which the government is particularly concerned about, they're going to be less cautious, let's put it that way. They'll be out there and mixing and meeting and traveling and all that. The older population, the more vulnerable population, will be more cautious. So it's likely there's going to be a spike. As to how bad that spike will be and how much of that will convert to hospitalizations and deaths, the hope is that enough people who are vulnerable would have been vaccinated, so it's not going to be as bad as it should be. The Delta variant, like you mentioned, it is a big concern because they say it's about 1.5 times more or twice as contagious as the regular one we're used to. So there's a lot of concern about the spread. Now, about hospitalizations and deaths, the fingers are, everybody's keeping their fingers crossed. By the way, 50% of all hospitalizations are due to the Delta variant. So it is a concern for sure.
And nearly 15 million people or more than 1 in 10 of those eligible in the U.S. have missed their second dose, we're told, by the Centers for Disease Control and Prevention. Why does it appear that people aren't getting the second doses?
That's a very controversial thing over here, especially between the two parties. And a lot of it is fear. Well, two things. Fear that there might be some complications, especially in the southern states, within the Republican-led states. The other thing is that some people say that, well, if you've already had the virus, I've already had the infection, it's supposed to confer. And there haven't been any argument against that. There's not been any proof against this point. It's supposed to confer upon you the same amount of resistance as getting the vaccination. That's the argument Republicans are coming up with. And so they're saying that why put people at risk if they have already had the vaccine? The other thing, of course, is with the younger age groups. They halted the vaccines for the younger age groups from 12 to 18 because they saw some cases of probably some bad reactions. In fact, there's a video that came out a few days ago by a senior senator, Ron Johnson, who was interviewing people who had severe complications from the virus, and it's all over YouTube now. So it's getting a lot of people scared. So that is the challenge now, is the fear and the quote unquote science that maybe they may not need it. And so there's a lot of back and forth going on, unfortunately.
So with this political dimension to this argument, this is a public health emergency. What advice would you say, what should the public messaging be, especially coming from government?
Public messaging is most especially if you're vulnerable or you feel you're going to be vulnerable, you should get it from the government. You should get the vaccine. It's been shown to be helpful in many, many instances. If you're in the US or in a country where you can test for antibodies and you feel you've had the virus and you want to test and make sure that the antibodies are okay, are adequate, then that's the other messaging that is there. Test for the antibodies, just to make sure that you are protected. And of course, you've got to continually stay safe and be alert. I mean, this thing, surprisingly enough, it's hitting the healthy ones as well, and the active, as well as those who are vulnerable. So it's not something you should take lightly at all.
All right, we always appreciate your time on the program. Dr. David Ajibade, CEO of Brain and Body Foundation. Thanks for joining us.
Thanks for having me.
As many as 975 school children are at home isolated in the town of Tamworth in Staffordshire, set to have the second highest infection COVID-19 rate in England after a 225% rise from a rate of 202 cases per 100,000 to 657 in the week up to June 30. The county council says cases had rocketed and thousands of pupils and school staff had been asked to get tests to try to get on top of the situation. Here's more on the global update.
Rising COVID-19 cases are not the only highlight in Britain today. So is the tribute paid to the country's National Health Service workers with a service of thanksgiving at London's St. Paul's Cathedral. The Duke of Cambridge, Prince William, was in attendance, although his wife, Kate, was self-isolating after contacts with someone who had tested positive to COVID-19. Prime Minister Boris Johnson, the newly installed Health Minister, Sajid Javid, and opposition Labour leader, Keir Starmer, also paid their respects to the state-run health service. Millions of miles away, Mexico is bracing for a coming third wave of coronavirus cases, amid fears that an easing of measures to stop the spread of the virus will see new strains take hold. Infections have spiked 64% in 3 weeks, according to Health Ministry data. Despite the spike in cases, deaths and hospitalizations have remained fairly low. Russia has reported more than 24,000 new COVID-19 cases today, including 6,557 in Moscow, taking the official national tally since the pandemic began to over 5.6 million. The government coronavirus task force says 654 people have also died of coronavirus-linked causes in the past 24 hours. Finally, Luxembourg's Prime Minister, Xavier Bettel, was admitted to hospital on Sunday following a positive COVID-19 test at the end of June. He was undergoing additional tests and would remain under observation for 24 hours as a precaution. Bettel in late June took part in a two-day EU summit in Brussels, where participants included the French President Emmanuel Macron, Italian Prime Minister Mario Draghi, and other EU leaders.
Don't forget to protect yourself. Continue to take responsibility. You can see more updates, a better understanding of the pandemic on our website. It's channelstv.com. You can find several other stories there as well. News, sports, of course, business. And there you have our top story on our coronavirus segment there. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.